completely off the books, doctor, just like asking for my own personal knowledge. As somebody who's like practicing in the US right now, would you recommend that, medical students today would have a better time coming there to practice medicine, or would you say that it's going good in India as well?
It's tough for me to answer that because I've been away from India for so long. It's hard to know what the system is anymore. I know that.
Yes, Rohi and Doctor, now it's live, so we can start with the intro only, and we
Okay.
can continue.
Thank you. Uh, Hello and welcome everyone to Ask My Doctor, an exclusive Q&A session sponsored by My American Doctor. And today we're honored to have with us Dr. Kailash Narayan, who is a leading neurosurgeon and a top specialist in the USA. Thank you so much, doctor, for joining us.
It's my pleasure. Thank you.
How are you doing today?
Doing very well. I hope you all as well.
Thank you. Before we get into the questions, could you tell us a little about yourself, please?
Well, born and grew up in India. I actually did my MBBS in India in Tamil Nadu, place called Christian Medical College in Vellore. And then came to the US and finally got into a residency program in neurosurgery. And at this point, I've been practicing as a neurosurgeon for just over 30 years now. Time flies, really.
30 years, that is a long time. Thank you so much for deciding to spend your Sunday evening with us. Thank you. We appreciate that so much. Doctor, so like getting straight into the questions, what do you say are like the biggest risks of neurosurgery?
Risks of neurosurgery, or what kind of things do we treat?
I would say risks. And also, you know what, let's just start off with what you treat and how they might, go on to have several long-term effects and risk factors for the rest of your life.
It's hard to generalize. So, in generally looking at it from a mile high view, neurosurgery and its sibling neurology, we deal with disorders that affect the brain, the spinal cord, the nerves, and the two specialties approach it slightly differently. The neurologists treat conditions that are generally treated with medications, while the neurosurgeons treat disorders involving the same organ, but more structural. So we have to remove things or add things depending on what's going on. And so it's a little bit of a broad field, and so it's very hard for me to generalize as to what the biggest risks are, because it would really depend on so many factors: the age of the patient, what are we treating, how healthy was the patient to begin with. A lot of things come into play. But generally speaking, complications in neurosurgery can be quite serious because the brain doesn't have as much of a recovery potential as some of the other organs have. So puts it at somewhat of a higher risk.
Mm-hmm. Thank you, doctor. And in your opinion, as you just said, you had like 30 years of experience. What would you say is like the latest like advancement in neurosurgery, something that's very remarkable to you as of now?
In general, again, surgery is going from maximal surgery to minimum surgery. And ultimately, the goal, of course, is to try and avoid surgery at all, if at all possible. And so the movement has been the ability to make smaller incisions, smaller openings, the use of devices like endoscopes and robotics also to some extent, though not as advanced on the neurosurgery side, but trying to treat more conditions non-surgically, if at all possible, with medicines or radiation treatment or things like that. Again, depends on what's going on. But in general, the move is to try and reduce the amount of surgery that a patient needs to undergo and still get good results.
Mhm. And do you see that in most of your patients, they tend to have like lifelong effects after the surgery?
Some do, some don't. It once again would depend on what condition that they came in with and what was done for them.
Mhm.
Sometimes they can have lifelong effects, and sometimes they can have excellent recoveries. Depends, really.
Mhm. Thank you, doctor. And as you've just said, I feel like we need to get into the case questions to get like a more specific opinion on several diseases or disorders that we want to discuss. So let's just get right into it. So we have a few questions from the audience, and I'm going to read a few of them out for you. The first question goes as so. My mother has been having frequent headaches, trouble remembering things, and sometimes feels dizzy. Her doctor ordered an MRI and mentioned the possibility of a brain tumor. How serious could this be, and what are the next steps?
How serious it would be and what the next steps are really would depend on what the MRI shows. If the MRI shows that it is indeed a brain tumor, then it becomes a question of where is it located? What kind of tumor does it seem to be looking at the imaging? Is it something that we can clearly state is responsible for the patient's symptoms? And is it in a location that it can be removed? Is it, what is the general health of the patient? Is the patient relatively healthy and capable of undergoing the surgery? So those would be the factors that come into play in order to decide what to offer next.
Mhm. Doctor, can you tell us more about the symptoms of a brain tumor? Like
Yes,
the early warning signs, is so if I may specify.
the symptoms can be very variable. It is different from, say, if you have abdominal problems, a lot of people have abdominal pain. There is dealing with brain tumors, for example, a lot depends on the location of the tumor, how long it's been there, whether it's slow growing or fast growing, and whether it's on the left side or right side. So there's so many variations that sometimes we see people who, based on the MRI, have very large tumors, but it only got picked up accidentally. They hit their head somewhere, they were having headaches, and somebody got a scan, and the scan shows this very large tumor. And until they hit their head, they said that they were feeling fine. And other people can have something like a seizure, which is like epilepsy, as a result of irritation of the brain from the tumor. If the tumor is located in a part of the brain that, say, um, enables movement, you can have weakness on the opposite side of the body. It can also result in symptoms that can resemble dementia. They'll think that grandma is acting a little bit not like herself. Her memory is poor, her walking is poor. Could that be dementia? And it turns out to be a tumor. And so the brain is responsible for so many things. And each of those, it's responsible for thinking, for movement, for speech, for sensation. So if you take all those things, depending on the location of the tumor, any or all of those could be affected.
Mhm. And obviously, all brain tumors are bad, but what times is it that you just go like, oh, which part of the brain do you think if you find a tumor, you're like, oh, this is okay, not so bad, and which parts would you be like, oh, this is really bad, like I do not want this to be here.
Yeah. So generally speaking, if anyone had a choice as to which location of the brain to pick the brain tumor in, then the answer to that question would be the right front part of the brain would be the one to pick. And the reason is that it's considered the less, what is the exact word, eloquent part of the brain, meaning that you can get away with an injury or removal of that part of the brain with seemingly less symptoms after surgery. While in other parts of the brain, removing a part of it actually becomes nearly impossible because it's responsible for very important brain function. And so the reverse of that question is, if you were going to pick a location and you were going to pick the right frontal lobe, which is the part of the brain that's above the right eye, say to speak, right in this area, where you don't want to have a tumor is especially on the left side, particularly in the deep parts of the brain.
Why do you say this, doctor?
Because the left side has a lot to do with language function, and losing or having a problem with language function is very disabling for people. And by language, I mean the failure or the difficulty with speaking, with understanding, with creating language, not just the ability to speak, but the ability to even understand what you want to say, to understand what is being said to you. All that formulates really what makes us unique. That can be lost in left-sided injuries and left-sided tumors. And deep parts of the brain are always worse places to have anything because it's harder to get to them. You have to go through normal brain to get to them. And so if you had a choice, again, you would like to pick something on the superficial parts of the brain.
Thank you so much, doctor. And what would you say is like the current like success rate of brain tumor surgeries? Like, what does the prognosis look like?
So a lot of that depends on what the tumor is. If it is, they're very broadly speaking, let's say two kinds of brain tumors. There are brain tumors that start on the surface of the brain and they grow into the brain rather like a raisin in a pudding, so to speak. It displaces the brain. And then there are brain tumors that actually are in the brain itself. They grow from cells that are within the brain. And then in each of these, they can be what we call benign, meaning they are not cancerous, or they could be malignant, which are cancerous. And then depending on whether it is benign or malignant, also determines then the outcome. And again, the location becomes important because in certain parts of the brain, you can take all of the tumor out, which is a good thing. And certain parts of the brain, you cannot take all the tumor out. And so if you have a cancerous tumor in an important part of the brain and you cannot get a lot of it out, the outcome can be quite bad. On the other hand, if you have a non-malignant or a benign tumor in the surface part of the brain, particularly on the right side, and you can take all of it out, you can have almost normal recovery and long life after that with no symptoms. So what the tumor is makes a huge, huge difference.
That's wonderful, doctor. And do most people usually go on to require chemotherapy or radiation therapies after the surgeries?
For most cancerous brain tumors, the answer is yes.
Mhm,
For benign brain tumors, usually not.
mhm. And are you consulting with an oncologist when you're operating on these brain tumors, doctor, or is it completely a neurosurgery side?
Most treatments now are a team effort, you see. So there'll be a primary care doctor involved, a neurologist involved, reasonably often an oncologist, which deals with the chemotherapy part. And then you have other oncologists, they're known as radiation oncologists. They are responsible for the radiation part.
Mm-hmm.
And then there is the neurosurgeon. So it's all a team effort. The neurosurgeon gets a biopsy or removes the tumor so they know exactly what it is. And then, depending on exactly what it is, the oncologist and the radiation oncologist determine what kind of chemotherapy and what kind of radiation and how much radiation they need to give.
Mm-hmm. Mm-hmm.
So it's a team effort, really.
Mm-hmm. Going back to when you said that, most people come in, they've like hit their head, and then you go on to look at their scans and you probably come on to diagnose a tumor. So how often do you think like normal people should get tested for us to catch tumors, especially brain tumors, earlier?
That's a tricky question because there is really no screening test. For example, there are recommendations in general healthcare that people should, like women, should get mammograms at starting at a certain age every year to early detection of breast cancer. There is colonoscopy for early detection of colon cancers and things like that. But there is no such thing for brain tumors, at least not as yet. So maybe in the near future, there may be some blood tests that may come up, genetic tests that may um, lead to some early diagnosis, but currently there is no screening.
Mm-hmm. Oh, well, that's a little bit scary, honestly, to hear about. But thank you, doctor, for explaining this to us. And moving on to the next question. So we have a question that goes, my uncle has been experiencing back pain for months, and now he's having trouble moving his legs. His MRI showed a mass in his spinal cord. Could this be cancer, and will he need surgery?
Yes, the answer to that is to both parts of that question. The answer is yes. Could this be a tumor in the spinal cord? Is a very serious thing. Many tumors in the spinal cord are cancerous, but even those that are not cancerous can be quite dangerous because the spinal cord is a very small, tight area, and it is very susceptible to injury. And an injury in the spinal cord often does not recover well. And so the answer is yes, it could be cancerous, but even if it is not, it is a very dangerous thing to have. Uh, and it is possible that, in spite of all treatments, the patient could lose function in their legs. But finding out exactly what the tumor is, trying to remove it if at all possible, and then depending on the type of tumor, often would need radiation treatment to follow.
Mhm. And then, as you said, doctor, they tend to lose function in their legs. Why is it that the upper limbs are not so easily affected?
It would depend on where the tumor is. If the tumor is in the neck part of the spinal cord, that is known as the cervical spinal cord, it can affect the legs, the arms as well. If it is lower down, like between the shoulder blades or even lower, then it might only affect the legs. So location, again, everything to do with the nervous system, the location becomes very important. Brain, left side, right side, deep brain. In the spinal cord, it is whether it is in the neck part of the spinal cord or in the back part of the spinal cord that determines whether the legs and arms are affected or only the legs are affected.
Mhm. And doctor, what would you say are the signs of a tumor in the spinal cord?
It could be weakness, clumsiness, numbness, and sometimes difficulty with urination and bowel control.
Mhm. And usually, doctor, can spinal cord tumors be completely removed? Like, is it a completely treatable cause due to surgery?
It can be, yes.
Mm-hmm.
Again, it depends on the kind of tumor. Some of the tumors can be completely removed and they have a very good prognosis, while others are difficult to get a good complete removal and often need radiation treatment and things like that. And the outcome can be less successful.
Mm-hmm. And what do you think the prognosis looks like? Like, do you see a lot of your patients getting better, or is it like a more tougher thing to overcome?
Luckily, spinal cord tumors are relatively very rare. And so, um, and that's a good thing because the outcome, as I mentioned, there's the amount of space in the spine is very little. And so tumors in the spine that affect the spinal cord are in a very dangerous neighborhood. And even very small amounts of trauma, even the trauma of surgery, can make the patient much worse than they were even right at the beginning. But it is relatively rare, and seems to be a little bit more common in children. So they often go to pediatric hospitals and pediatric surgeons.
Mhm. So, as you said, it's harder for you to operate on these tumors because it might end up causing more damage. So, would you say that you'd recommend your patients to go for the non-surgical treatments over a surgical treatment? And what would the non-surgical treatments usually look like?
So the first thing you have to do is to establish a diagnosis. And that often involves a biopsy. A biopsy means opening the area involved and taking a small piece of it and sending it to pathology so that they know exactly what this is. And then, depending on that, there are some tumors that you do need to try and take out all the tumor, if at all you can, because that gives them the best outcome. And there are other tumors that it is not possible to safely take them out. And in those people, you would just do the biopsy, and after that, they would get radiation treatment.
Mhm. Mhm.
So again, a lot depends on exactly what this is, and they often need a biopsy, which is taking a small piece of it through surgery to know exactly what's being dealt with.
Mhm. And as similar to brain tumors, do spinal cord tumors also not really have a screening test as of now?
I'm sorry, I didn't hear the last part.
Oh, similar to brain tumors, would you say that, spinal cord tumors also do not have screening tests as of now, doctor?
Yes, yes, there is no screening test.
Thank you so much for breaking that down for us. Going on to the next question. Uh, my friend hit his head in a car accident last week. He seemed fine at first, but now he's forgetting things and has bad headaches. Could this be a delayed effect of a brain injury? Does he need further tests?
Yes, it could be a delayed effect of a head injury, and he could have gotten a little bit of a bleed from the injury that happened right at the beginning. And if he didn't feel that bad at that point, he decided to just go on with his life and then slowly started to feel worse and worse.
Mhm.
It could be the development of a little bit of a bigger blood clot. And so, yes, if his symptoms are bad enough, he should get it checked, should often wind up getting a CAT scan of the head.
Mhm. And how do you know if a concussion is serious, doctor?
So, generally, if the definition currently of a concussion is an injury that results in transient, meaning short-term alteration in level of consciousness, meaning somebody just gets shocked or stunned or they're not themselves for a little bit. and then they return to normal. That is a concussion. So if somebody just has a head injury and they transiently blank out and they don't know what's going on, but within a few seconds or a few minutes, they come back to normal, and after that, they feel fine, they're probably okay. But if they remain confused and somewhat disoriented and not acting right, then they definitely need to be checked out.
Mhm. What does the usual method of treatment look like, doctor?
So, a good neurological exam to begin with, normally that they would probably go to either their family doctor, to the emergency room, a casualty as they call it in India, and get evaluated. And if they have any neurological signs, they wind up getting a CAT scan of the head. And then, depending on what that shows, they might not need anything, maybe just a few days of rest. On the other hand, if it shows something more serious, then they might need to see a neurologist or a neurosurgeon.
Mhm. And doctor, can brain injuries cause permanent damage? Is that very common?
Can what?
Can brain injuries cause permanent damage? Is that very common?
It's, well, a severe brain injury can cause long-term permanent damage, yes.
And what does the damage usually look like? What are the aspects or skills that get affected first or more severely?
Again, just like in brain tumors, it's hard to generalize because it depends on which part of the brain has been injured the most. But I would say the most common complaints after head injury is persistent headaches and personality changes that the family usually complains of. The patients themselves don't really know it very well, but the families can say, after he had this injury, he doesn't quite act like he used to, that kind of thing.
Mhm. And how long does it usually take to recover from brain injury? I understand that these are very generalized questions, and I know most of them are based on severity, but like, what is the most common case, doctor?
From days to weeks. And
Mhm.
in very severe brain injuries, they might be permanently disabled.
Mhm. And what is the immediate like effective thing that you do if somebody comes in with with a head trauma?
They would get neurological evaluation and at least a CAT scan of the head. And then, depending on what that shows, would determine the next parts of the treatment.
Mm-hmm. Mm-hmm. Thank you so much for breaking that down for us, doctor. So moving on to the next question. The question goes, so my cousin fell from a ladder and can't move his legs. The doctor said he has a spinal cord injury. Is there any chance he will regain movement and what treatments are available?
So, that is one of the most serious injuries that anyone can have, because what that person seems to have sustained is a spinal cord injury. And then, broadly speaking, there are two levels of spinal cord injury. One is an incomplete injury, meaning they still have either sensation or small amounts of movement in their legs, for example, or in their upper extremities. And then there's complete spinal cord injury, in which they have no sensation, no movement below the level of injury.
Mm-hmm.
In partial or incomplete spinal cord injuries, there can be recovery, but in complete spinal cord injuries, usually there is no recovery.
Mm-hmm. Doctor, what would you say are the chances of walking again after a spinal cord injury?
If it's a complete spinal cord injury, the chances of walking are very, very low. If it's an incomplete injury, then I would say it would be a reasonably good chance, or at least walking, even with some degree of weakness, but they might be able to walk.
Mhm. And doctor, could you run us through what the treatment to a spinal cord injury will look like?
So it would, there are two parts of injury to the spine. One is injury to the spine itself, which is a fracture, it's a bony injury. And then within the spine runs the spinal cord, which is the neural element. And if what the treatments so far, by and large, deal with treating the bony element, which is you stabilize the spine, which is you fix the bones that have been broken. And if there is a blood clot or something that's pressing on the nerves, you drain the blood clot. But currently, at least, there is no direct treatment for recovering nerve function.
Mhm.
Once the spinal cord is injured, that part of the spinal cord usually does not recover.
Mhm. So what you're saying is basically the nerve damage in the spinal cord cannot heal over time?
Correct.
Mhm. And how does a spinal cord injury affect bowel or bladder control, doctor?
If it's a complete spinal cord injury, then both of those are affected. And very often, people will require tubes to be put, especially into the bladder, periodically, every 4 hours, every 6 hours, to drain the bladder. And they also put on what's called a bowel program, which helps train the bowel to evacuate once or twice a day. And this is really important because when people have spinal cord injuries, it is an extremely devastating injury and they require a lot of care and maintenance. And here is where we have a specialty called physical medicine and rehab, and they specialize in helping people with head and spinal cord injuries recover using a lot of physical therapy, occupational therapy, and even psychiatry and psychotherapy to help deal with them, because they can also have serious things like depression, anxiety, anger, because of the severity of the injury. And so this is another area where multi-specialty care becomes extremely important.
Mm. And doctor, would you say that any new treatments to help, recover from spinal cord injuries better or quicker?
Currently, there is nothing that is on the market. There are experiments and research that are being done, but currently there is nothing that has been proven to improve recovery, other than what I just mentioned, which is physical therapy, etc.
Mhm. Thank you so much for your insights, doctor. Going on to the next question. My father has been having back pain and numbness in his legs. His doctor said he has a herniated disc and might need surgery. Are there any other treatments, and how do we know if surgery is necessary?
So a lot depends on, again, the severity of the symptoms. How bad is it? Is it very severe? Is it moderate? Is it mild? Is it associated with only pain, or is there weakness as well? If there's a lot of weakness and a lot of pain, then it implies that it's a very large herniated disc and maybe it may not recover by itself. On the other hand, if it's a small or medium-sized disc and the symptoms are mild to moderate, it might recover by itself. So it is not necessary that every herniated disc in the back needs to have surgery. It depends on how big it is and how symptomatic the patient is and how long they're willing to give time to see if it gets better by itself before going for treatment.
Mhm. And doctor, could you just explain to us what a herniated disc is or what spinal degeneration is?
Yes, a disc is a cushion that sits between the two bones of the spine. Think of the spine as a train, with each compartment being the bone and the link between each compartment being the disc. So think of the engine as the head, and the bogies are the vertebral bodies. And between each of them, imagine that there is a cushion. Right now, there's only that little passage, but imagine that there's a cushion. That cushion is known as the disc, or uh, uh, the the disc, which is again a cushion. And the cushion consists of two parts. Think of it as a tire. It has the outside tire and it has a tube on the inside. A herniated disc is when part of the inner tube pokes out of the tire. And depending on which way it pokes out, it goes and presses against a nerve. And that nerve then causes the pain, the numbness, and the weakness.
Mm-hmm.
So a disc is a cushion that sits between two bones that constitute the spine.
Mm-hmm. Thank you so much, doctor. And do you find that herniated discs are usually treated like the pain is completely relieved by surgery?
The quick answer is yes. I think that the results of surgery, if the patient is not getting better and they've given it enough time and they've had some therapy, some massage treatments, some exercises and medicines, if those are not helping, then surgery is a good option. And the results, I would say, are very high. Between 80 and 95% of patients will feel better right away.
Mm-hmm. And can a herniated disc come back after being treated with surgery?
Yes, it can.
Mm-hmm. And what would you say are the best non-surgical treatments for a herniated disc?
I don't know if there is a best treatment, but there are many treatments, and time is one treatment. Just give it time. Taking medicines like aspirin or metacin or those kind of anti-inflammatory medicines. You can take steroid medicines like prednisone that are stronger anti-inflammatory medicines. You can have therapy, massage treatment. Here in the US, you have a group of doctors known as chiropractors that manipulate the spine. In India, I think you have massage therapists that also use similar techniques. You can go to physical therapy. You can have machines they've developed that stretch the spine and help maybe push the disc back into place. All those are, and you can even have injections in the spine known as epidural steroid injections.
Thank you so much, doctor. And uh, moving on to the next question. My aunt suddenly had a severe headache and collapsed. The doctors say she has a ruptured brain aneurysm. What caused this and what are her chances of recovery?
So, an aneurysm is a weak area on a blood vessel that goes to the brain in this case. Think of it like a soap bubble. So think of it like sometimes if you've seen old cycle tires where the rubber has worn out and some of the inner tube is poking out like a little balloon, that is basically an aneurysm of the brain. And people are usually born with it. And as they get older, it slowly gets bigger. And the biggest risk of it is bleeding, because remember, blood is passing through this. And if the wall of the aneurysm becomes very thin, it can bleed. And that's a very serious thing because, again, there is no screening test for this condition. And many patients who present with it come in because for the first time they have this severe headache and some of them just become unconscious. And when you do a CAT scan, they've got a lot of blood in the head. And when you do other studies known as angiograms, it shows you the aneurysm. And then the treatment of aneurysms now has advanced very, very well. Several years ago, the only way to treat them was with open surgery. But now they have a treatment known as endovascular treatment, which is similar to people getting cardiac catheterization. You can have brain catheterization, and they're able to put glue or wires into the aneurysm to clot it off and prevent it from bleeding again. So there have been a lot of advances in the management of brain aneurysms over the last couple of decades.
And what would you say are the risks of brain aneurysm surgery, doctor?
The risks are pretty much the same, excuse me, the same as for any brain surgery, which is bleeding, stroke, infection.
And can brain aneurysms be treated without surgery, doctor?
Yes, as I mentioned, they can be treated with putting balloons in them or putting wires in them by going through the blood vessel, which completely avoids surgery and is very effective. And I would say that probably 80% of all aneurysms now are treated that way.
And what are the long-term effects of having a brain aneurysm, doctor?
It all depends whether it's been caught before it bleeds or after it bleeds. If it's caught before it bleeds, patients can often be completely asymptomatic after their treatment. On the other hand, if it has bled, a lot depends on how sick they got because of the bleed and if they get, because the almost 50% of patients who have an aneurysm that bleeds can often just die on the spot. So it's a very serious thing. And so those that survive and they come to hospital and they get their treatments, a lot depends on how bad that initial bleed was. If it was a mild bleed, they can have an excellent recovery. If it was a severe bleed, they can be left with problems like weakness, numbness, psychological issues, memory issues, that kind of thing.
And how can you prevent a brain aneurysm from rupturing, doctor?
So the general measures are things like if people have high blood pressure, they should keep their blood pressure under good control. But other than that, the only other way to prevent it from bleeding is to block it, either using the balloons or the wires or with surgery.
Uh, Thank you so much for your insights, doctor. And I, for one, am loving the analogies. Thank you. So going on to the next question. My nephew was diagnosed with hydrocephalus, and the doctors say he needs a shunt. What does a shunt do, and will he need surgery again in the future?
So hydrocephalus, the very meaning of the word is the buildup of fluid in the brain. And this happens, you have to think of it as, let's go to another analogy. You're looking at the kitchen sink. You have water that's coming into the sink and water that's draining out of the sink. And the amount of water coming into the sink should be equal to the amount of water draining out of the sink. But imagine if the sink, for whatever reason, is not draining properly, but water keeps coming in. So you then imagine that the sink now has filled up and now is overflowing. That is a visual interpretation of hydrocephalus. Is the fluid in the brain is being produced, but the mechanism of draining it is not working. And so they put what's called a shunt, which basically is a tube connected to a valve that drains the fluid from the head into the abdomen. and provides an alternate channel. It's just it's like putting a second drain pipe to drain the fluid.
Mhm. And what usually causes this fluid buildup, doctor?
Inflammation can cause it. It can be secondary to head trauma. It could be secondary to, say, an infection.
Mhm.
And in children, they can be born with it. It's something that they are born with. That's called congenital. So this condition is very common in children. In adults, it is usually related to something like severe head injury, a ruptured aneurysm, a brain infection, or a tumor that can cause it.
Mhm. And doctor, will a shunt for hydrocephalus usually need to be replaced? Hello, doctor. I'm sorry, did you get that? Doctor, I don't know if you can hear me, but there's a little bit of a break in your video. And to everybody watching, if you do want to consult with doctor or any of our other doctors, please go on to the My American Doctor website, or you can contact us at 9914941494. We'll just take a second here.